You're watching the big story on Mirror Now. I'm Mamta Balachandra. Straight up to our big story today, and an RTI query on LGBTQ blood donors has sparked discrimination debate. RTI activist Chetan Kothari asked NACO, the nodal body for AIDS control in India, if the LGBTQ community is allowed to donate blood. Now, NACO categorizes the community as a high-risk group for HIV/AIDS and other sexually transmitted diseases. Now, the organization chose not to respond to the RTI, but has instead forwarded it to the Directorate General of Health Services at the centre. But the RTI query and NACO's action has nevertheless sparked an uproar, with activists alleging discrimination. And here's what we're asking at Mirror Now. Mirror Now questioned NACO on this issue. The organization distanced itself from the controversy. However, they maintain that the LGBT community is a high-risk community.
We are not doing any discrimination and stigmatized to that community. They are treated as high-risk group. By appearance also we can see the patient is a high-risk group. But after good counseling, for our all blood banks, we are instructed that after your counseling, pre-counseling, then you decide whether the blood is taken or not. High risk, previously I told that there are types of high risk. IDV is also one of that he is not doing the behavior of sex, but he is giving the injection, through injection the HIV can go, hepatitis can go, baki rest of the diseases also can appear.
लेकिन एट द टाइम ऑफ डोनेशन हमारा जो काउंसलर रहता है हर एक ब्लड बैंक में, वो काउंसलिंग करता है बंदे को, और जो काउंसलिंग में उसको अगर समझ में आया कि ही इज़ हाई रिस्क बिहेवियर, उसकी ही इज़ हैविंग हाई रिस्क बिहेवियर, तो तभी हम उनको कहते कि आप डोनेट नहीं करो, या उसको अलग रीज़न से डिप्लॉय करते हैं ब्लड डोनेशन करने से। ऐसा नहीं कि हम किसी भी कम्युनिटी को डिस्क्रिमिनेट करते हैं कि आप डोनेशन मत करो।
Now, this has not gone down well with blood donation camps and the LGBT community. They say profiling will discourage donors.
It can be very harmful to the blood banking services, because the donors will get, if they get offended, they are unlike, they might turn away the other people also, they kuch bhi puchte hai, that sort of thing. So there it becomes extremely difficult to ask this question. Now, under the circumstances, even if those guidelines are there, in a say camp where there are 200-300 people are going to donate, they are in the queue, the total privacy of a person is exposed.
सोसाइटी के अंदर डिस्क्रिमिनेशन बढ़ा रहे हैं स्टेटमेंट से। हम जहां इतने सालों से लड़ रहे हैं सेक्शन 377 को लेट डाउन करने के लिए, हम जहां लड़ रहे हैं कि टीजी बिल पास हो जाए और टीजी राइट्स आ जाए, डिस्क्रिमिनेशन और स्टिग्मा को कम करने की बात कर रहे हैं एज अ एक्टिविस्ट ऑफ LGBT कम्युनिटी पर से, पर ऐसे स्टेटमेंट से वो चीज़ों को और पीछे और धकेल दिया जाता है, या ये डिस्क्रिमिनेशन और स्टिग्मा को और बढ़ावा मिलता है।
LGBT के जो भी डोनर हैं वो अगर ब्लड डोनेट करना चाहते हैं तो बेशक कर सकते हैं।
सब लोगों में अवेयरनेस करना चाहिए। सिर्फ एक किसी कम्युनिटी को आप बंद करके तो ये गलत होगा, क्योंकि हमारे जैसे थेल्प पेरेंट्स जो है जिनके बच्चों को हर 10 दिन 12 दिन 15 दिन में लाइफ टाइम ब्लड चढ़ना है, उनके लिए ब्लड की बहुत शॉर्टेज हो रही है।
एनी ब्लड, बस हमने ब्लड थी मतलब चाहिए, नेता आवे चाहे अभिनेता आवे, चाहे आम आदमी आवे, चाहे खेडूत आवे, चाहे मजदूर आवे, बस हमारे ब्लड थी मतलब चाहिए।
Now, here's a question we're asking on Mirror Now. Should sexuality be a criteria for donating blood? That's what we're asking. We also have Harish Iyer, gay rights activist, joining us now. Harish Iyer, obviously, NACO there saying that the LGBTQ community is a high-risk group.
Any kind of sex which is done without a condom or with is unsafe sex is a high-risk group, and that's what the NACO should be saying. Whether it's LGBT community or whether it's a heterosexual community, whether it's whoever it may be, or whether it's sex with a transgendered person, as long as the person is safe, there is very little possibility of that person of the person being HIV positive. So what we need to focus on is safety. And for safety, what we need to focus on is taking the history of the person, and if the person confesses, when the blood donor confesses that the person has had unsafe sex, then possibly you should not be taking that person's blood, irrespective of what sexuality the person comes from, what gender the person is from. So I think everyone is vulnerable in that aspect.
Now, the other thing that I want to point out is one of the doctors, of course, said that there is no stigma attached to this, and this is not discrimination, but by appearance they figure out who the high-risk group is. But tell me this, is there any way to identify one's sexuality and decide whether that person is a high-risk group or not?
I think it's pretty hilarious that they are making such statements. How did you identify? I mean, if the doctor comes and stands in front of me, I'm sure that I will not identify him as straight either. You know, I might also assume that he's gay, or I might assume that he's bisexual. How does anyone assume the sexuality of another person by just looking at that person? There are a lot of heterosexual people who are effeminate. There are a lot of homosexual people who are not effeminate. So to actually stereotype something like that, and to say that, you know what, all homosexuals look a certain way, they talk a certain way, and that's why they are high-risk behavior. And this is precisely, in fact, the doctor is actually reinstating the statement that Sachin had made a while ago, and the statement that I would also be making is the fact that this leads to discrimination. This is actually leading to discrimination. The doctor is actually standing testimony, his statements are standing testimony to the fact that he himself is saying that I will discriminate.
Absolutely. Now, while we talk about discrimination itself, now while you go to blood banks, is there any sort of discrimination that the community goes through? Now, of course, NACO has said it is a high-risk group, but give me personal accounts. Are there any, I mean, have you faced any discrimination?
I have gone through the form. I'm a regular blood donor, so I've gone through the form, and I know that there was this one or two forms where I've actually seen the mention of sexuality, and I've obviously I've obviously ticked on that, and my blood has been taken. So I haven't faced discrimination, and of course I've always gone through counseling. I've never given blood to a place where I've not been asked a few mandatory questions. And I don't engage in high-risk behavior. I don't engage in unsafe sex or anything of that kind. So my blood has just been taken. So, you know, so I think that you might have rules and you might have discriminatory rules, but as health practitioners, whether you want to discriminate or not, it comes to you and you personally.
But NACO has also said that this is because of multiple sexual partners. But in that sense, so to speak, even heterosexuals can have multiple sexual partners.
Absolutely. How do you look at a person and say that, hey, you are just a monogamous person, you just have one sexual partner? Or how do you look at, and how do you know that that person is only a homosexual? I know of many heterosexual women and men who have multiple partners, and it's a personal choice whether you want to have multiple partners or you want to have this thing. And the main point is whether you're safe with those multiple partners, you know. So it's not about your value of morality, your stamp of morality that you need to apply on them and say that, hey, you're having multiple partners, so you probably are unsafe or unfit, or your blood could be contaminated. As long as you're having safe sex, how does it matter whether you have single partners or you have multiple partners, whether you're homosexual or heterosexual?
In fact, we have the RTI query with us and a couple of questions that Chetan Kothari asked. Is there any provision that prohibits the LGBT community to donate blood? If previously there was any guideline or notification that prohibited them, then please provide the copy. For all of these things, NACO has gone ahead and said that the information is not available with the organization, but they've clearly said that they consider this community as a high-risk group. That in itself is discrimination.
It is absolutely discriminatory. I mean, how do you put labels on people? And they aren't even aware of the fact that when you put a label like this, when you call somebody a high-risk group, you are actually discriminating. So tomorrow, you might actually have people coming and saying that, hey, we don't need your blood is contaminated because you're from a high-risk group. And there is anyways a lot of stigma when it comes to HIV positive people. So this is actually adding to, the terminology by itself. When you call a certain set of people a high-risk group, the terminology by itself is so damaging, and the amount of work that organizations have been doing for years together, whether it's Aurinam in Chennai, whether it's Humsafar Trust in Bombay, and there's so many organizations which are working towards breaking the stigma, and years of that, and a small statement like this would actually topple things up.
But do you also think the added problem is that there is no clear law for discrimination in the community, especially because you obviously saying that this is just regressive mindset?
Yes, it is regressive mindset, and also when you have a law like Section 377, I mean, even when you have this monogamy and polygamy and monogamy debate, like you have multiple partners, why do you even assume that heterosexuals would not have multiple partners? Because they have the institution of marriage, right? And here, you two men, whether they are together or they break up, no one is actually bothered, because they are in itself, their kind of love making is considered illegal. So when you build institutions, probably you would get in the sanctity of probably monogamy and all those things also, though I don't propagate monogamy, but I'm saying that probably, so the best thing to solve all problems is get gay people married off, by your logic, not by your logic, I mean to say, by the argument that you place, that get gay people married off. If marriage is what makes them monogamous, then I suppose Section 377 should not exist.
So is this regressive mindset or actually in health risk? We also have Dr. Sanjeev Mehta on the phone line with us, and that is the question we're asking. Dr. Sanjeev Mehta, tell us this now. Does anybody's sexual preference actually determine whether they're a safe blood donor?
Yeah, thank you for calling me. The first thing is, I think it is far too complicated than to answer on a single line. And I think we do great disservice to a scientific debate when we bring it to a 1-minute clip, which is inadequate, and it is not fair to do to have a long discussion on a small clip like this. Having said that, I think we have to understand that it is not gay people or not. The thing is, there are, first of all, I think we need to get on to blood donation to be little better advanced. Right now, the blood, I think, is being tested on antibodies. We have to get to a P24 antigen testing to be safe for everybody. Point number one. Point number two, it has been traditionally, now this is part of genuine data that I am aware of, that there is a much higher incidence, used to be a much higher incidence of HIV prevalence amongst gay people. This is international data. I don't know whether we have Indian data. So before we answer the question, because it was higher, first is we need a better study to see what is the prevalence of HIV infection and other sexually transmitted infections amongst various categories. Once we have information of this kind, then I think we should start making rules and not regulations. These are more recommendations than anything else. So I think this is a more wholesome approach to answering a vexing problem like this. Get better scientific data, and then let's talk about it.
But Dr. Mehta, what do you make of NACO's statement, which they've considered the entire community as a high-risk group?
I don't want to support or go against anybody because I don't know all of it. All I'm going to say is get the data and then let's talk about it. But this has been the traditional data. So I don't think that they are completely right or wrong. They are basing it on old data. We need new information to be able to judge it. That being said, I think we need better testing to make sure that every recipient of blood is safe. I'm a doctor. I give blood on a regular basis to patients. I want to make sure that when I give blood, it is safe to everybody. I think we should get on to antigen testing, P24 testing, which comes positive or negative within 24 hours of exposure.
Harish, I respond to that. Respond to what Dr. Mehta said. He said that there needs to be better scientific data to talk about an issue like this.
Even if the I agree about the scientific data part, but even if we decide if the results come out that the LGBT community or the gay community or the men who have sex with men community, there is a high prevalence of HIV or any other any other disease that's transmitted to blood. Even if that is the case, what we need to do is still there could be a chance that still stigmatizing the whole community because of that would be a big disservice. So irrespective of the data, irrespective of what the results might be, you can say that it's you can say that, okay, if there is somebody who's HIV who says that he's gay, then you need to ask 2 more questions maybe to determine whether that person could be HIV positive, could not be HIV positive, whether his blood could be contaminated, whether the blood could not be contaminated. Add 2 more layers of questions maybe so that we could determine whether the person is the blood is contaminated or not. So, but to actually put a blanket this thing that everyone over there is going to be is somebody who's carrying. To give an impression that everyone who's gay is HIV positive or is carrying any kind of contamination in blood would be a big disservice.
Absolutely. And Dr. Mehta, you of course mentioned that we need data to back a statement like this. So in your view, do you think then that like Harish Iyer pointed out, that this is just regressive mindset?
No, I think what we it's very interesting, and I completely agree. It's not. I'm very liberal, and your personal life is completely your personal life, and I completely agree. There should be no stigmatization of anybody based on whatever their preferences would be. So I completely respect that. That being said, I think before we start talking, stigma and personal life is one thing. If I had to give a job to somebody, I would not even check. In fact, in the past, I have been a proponent that we have to stop all this thing in jobs and other things. But it is blood. May I ask you, ma'am, what level of security, if I had to give blood to one of your family members or to you, what level of safety would you like? This is not stigmatization. This is practicality of somebody's life. When one drop of blood given to you can cause, or to anybody, can cause a fatal disease, we have to put in securities. And one person who needs to be involved in this is the recipient. Maybe along with scientific data on what is the prevalence of infections, you would also like to take a very important player in this whole thing, or shall I say, you should, what we call them, stakeholder. One of the most important stakeholders is the recipient. Maybe we should do a study of the recipients and ask them what they feel, because they are the ones who are at the receiving end of it. Having said all that, and no question about stigmatization, please put science
but
there.
Dr. Mehta, while we agree to all of your points, the question we're asking is it fair to put a blanket ban or so to speak, to say that the entire group is a risky group? That's what we're asking.
I am not saying that you should say it or I should say it. I am saying look at the data, do a survey, look at the numbers.
So how is this any different from any other stigmatization, any other blanket stigmatization that we do with any other group?
No. I need to get into this. No, sir. Here there is a very important thing. Somebody may be working with me having HIV. As a doctor, I treat HIV patients every day. I treat patients with every disease. More than HIV, I treat patients with MDR TB, which can be a risk to me. So I don't differentiate. I don't even test them for HIV. I do operations. I don't test anybody. I never ask them. Because that is I think this is false equivalence. Here I am taking blood from somebody and giving it to somebody. If that patient carries even 1/10,000th the chance of a risk, I think every stakeholder would like to know that the quality of the blood is the safest, and whatever be the questions that may be asked. I think this is false equivalence. When you go for the job, no question. When you go to sit with me, have dinner, no question. You sit with me and anybody sits with the patient and has a party, no questions asked. But when you're taking blood which may be potentially infected, I think every stakeholder will
So that's why I personally believe that you should ask more questions.
Absolutely. And NACO has now gone ahead and said that they consider this entire group as risky group. In fact, a lot of doctors are also coming out and saying that just by appearance, they can figure out if this person is from the LGBTQ community or not. In fact, we have Ashish Pandya, LGBT activist, also joining us on the phone line. We have just about 2 minutes left on this show. Ashish Pandya, tell us, what is your view on this entire debate about NACO now considering the community as high-risk group?
My view on this NACO considering the community as high-risk group is that you cannot have a blanket cover on the whole community. The community may be at a high risk. It can be considered a high-risk group, but you cannot have a blanket cover and ban them from donating blood. Because in Western countries, you should have a midway in the policy. They have a period. They have a 3 months waiting period. They take a sexual history, of the person who is involved in sexual activities, and then they, take the blood or they deny the donation from the donor. So why can't we implement such good practices? Anyways, in India, there is lack of blood. People are dying because of lack of, transfusion of blood. So instead of making a blanket policy where we can just deny the blood on the basis of sexual, orientation and activity, it becomes very inhuman. The whole aspect of the whole spirit of blood donation is lost in this when you just give a blanket cover that the whole community. So tomorrow, some people would ban some communities or some caste or some religion on basis of their practices. So this is not the right way to do it. The policymakers should understand and bring a midway and should give a period. You should declare your sexual history not only for
absolutely. And now, in fact, NACO has gone ahead and said in an RTI query, of course, that they consider the LGBT community as high-risk group. But here's the questions we're asking. Should sexuality be a criteria at all while donating blood? How does one determine somebody's sexuality just by looking at their appearance? Is this actually a health risk or just regressive mindset? With that, I thank all of you for joining us here on Mirror Now. And that's a wrap on The Big Story. Stay with us.